Does your hip start aching when you've been standing for too long, walking a lot, or even just by the end of the day? A lot of people assume the hip itself is the problem, but very often the issue is actually poor glute support. Today I'm going to show you why your glutes matter so much and how to tell if they're not helping enough. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor, and here we are in Georgetown, Ontario, Canada. I practice One Life Family Chiropractic. If you have hip pain when walking or standing, I want you to consider checking your glutes first. And of course, if you're just tuning in, make sure you take a moment, subscribe and like so we can see more of each other along your health journey. In the big picture, I want you to remember your glutes help protect your hip and support how you move. The glutes help stabilize the pelvis, absorb force, and control the leg during walking and standing. And if they don't contribute properly, the hip joint may be absorbing more of the stress and muscles may tighten up and compensate around that area. This often can show up as that aching or tightness and potentially lowering the quality of your day so that you can't keep up and do the things you love to do. Especially if you're a busy parent, your grandma, grandpa, and you just want to do more, this video today is going to be some simple things you can do starting now. So why this happens and some things I want you to consider. Cause number one is sitting too much. The glutes become underactive and hip flexors may begin to tighten and the body defaults to the low back and the front of the hips. And cause number two, well, your glutes are just firing too late and they're not kicking in when they need to kick in. It's a timing issue, not always one of strength. And during walking or standing, your hip stabilizers don't kick in early enough to help support you and help support the way you move. Now, some common signs your glutes aren't helping enough. Maybe you have hip pain after walking. One hip may be tighter than the other. Maybe you have low back tightness when standing, or you're feeling exercises mostly in the hip flexors, hamstrings, and or low back. The hip is sometimes compensating for that missing support it needs. I want you to try this quick self-test. And what you're going to do is just stand on one leg. Do you notice any wobbling, pelvis drop? Do the hips shift off side to side at all? And this is often, if you notice this is often, well, one of the small muscles we call your glute med, which helps stabilize, move your hip, and helps you shift and move about your day so you can keep up with life. This is something I'm going to teach you how to support today. So what's the fix? Well, first of all, step one, I want you to work on taking a moment just to reduce some tone. And how I would do that, get your trusty foam roller out just like this. This is something that I use at the gym, I have one at the office, I have one at home. And what you can do is just work on the upper portion of your glute. You may find you have some trigger points through there. You work on your glute med. You can come over, you can work on your TFL over here, and you may find there's some really hot spots in there. What I want you to do is work on both sides, just because you notice maybe one side is a problem or a challenge or not as strong as the other. I still want you to work on both sides. So work on reducing some tone, and you can spend that time until it gets easier. This may be 60 to 90 seconds working on both sides. And when you find a spot, take a moment and just breathe, hang out. And when it gets easier, you've done your job. And then move on to the next area. Next, what I want you to do, well, step two is just work on restoring some motion. Remember, if you're sitting most of the day, your hips are probably going to be tight, especially in the front. So what you can do is get into the bottom of this lunge position and just work on breathing. You may hang out 60 to 90 seconds like this and just work on restoring some of that hip extension. If you want to make this a little more intense, what you can do, if you don't find it enough, you can take your hands, bring them overhead just like this, reach, opening up that whole front line. And if you want to take it one step further, what you can do is actually bring your foot up on the wall just like this. This is a great one. I still call it the couch stretch because it's easy enough to do at night on the couch or in your chair at work. But by putting some more tension to that front line, you're probably going to notice the hip flexor and the quad a little more. Remember, squeeze your glutes a bit. Don't let yourself tip over like this. 60 to 90 seconds of this position, working on opening up those hips so they're not so tight throughout the day. You're going to do this multiple times a day, 2-3 times, give it a try and see what happens. And of course, just working on some external rotation of your hip can really be useful as well. And all you're going to do, this is one of my favorites, you can do it on the edge of a chair or a soft surface or on the floor like this. And all you're going to do is just lean over. I try to keep my spine nice and tall and I lean over until I feel that tension through my glute. If you're really flexible, you may find yourself bringing your torso down even further. Right now, I'm just focusing on the breathing. Again, 60 to 90 seconds on each side. and I'll work on each side. You'll notice there what I've done in terms of restoring motion is taking two simple mobility pieces, your couch stretch and your hip external rotation stretch, sticking those together and then sticking with them for a period of time to watch what happens. Step 3 is you're going to actually work to rebuild support. And you'll notice today what I've done is actually put a band around my knees. Now I'm going to keep some tension through here and I'm going to open up into the clamshell position just like this. I'll let the tension go. I'll open up. And with this, you're working for 8 to 10 reps on each side. And when you come down, open up, pause, really focusing on, well, those small glute muscles. Come up, squeeze, and back down. You'll notice my hips flex a bit, and then I extend my hips and abduct my knees, which means separate them apart just like this. 8 to 10 reps on each side, and I would work back and forth. Do all one side, switch over, do the other side. And then when you transition, I want you to just work on your glutes directly. But I want you to work on a sense that keeping that glute med engaged, that small muscle at the top of your glute. And I'm going to have you actually use the band today just like this. And what you're going to do is go down, and the whole time this is going to force you to actually push your big toe down. But this band is actually going to encourage you to keep your knees abducted this way. And so cueing your glute muscles and just giving yourself that connection. And when you do it, 10 to 15 reps up, squeeze your glutes, pause for 1 second, and then back down. And the cool part about the band is you will probably notice your upper glute or your glute med muscle that much more when you do it. Hey, this final one, you guessed it. I'm actually going to do the monster walk with the band, just like this. And what you're doing, you'll notice, you see how my hips were hiking there? I got the band forced apart. So again, I'm cueing this muscle up here, and I hike my hips to move. So I may go 10 to 15 reps forward, and then I may go 10 to 15 reps back, the whole time keeping my upper glutes contracted and teaching my glute med how to fire, and just giving my brain-body connection in terms of that awareness of that muscle and how it should feel when it's cued. So 10 to 15 reps walking one way and the other way. Great way to help encourage you how to use your glute med a little more to help control that hip, that pelvis, and keep you moving at your best for life. As we wrap up today, remember, it's the simple things done consistently which often make a big difference. You have to stack these things together over time. And I don't want you to forget about the health of your spine and nervous system, which is often the X factor. Many people will present to our office here. We'll do a proper consultation, health history, understand their goals more. And once we dive into a biostructural examination, we start to understand more about where they may be compensating. And many people just don't realize that corrective chiropractic is much more about your nervous system. And your bones, yes, protect your nervous system, which your brain has an extension called your spinal cord, and your nerves talk to your muscles, organs, and help with how you heal. Now, your corrective chiropractor helps restore motion to your spine and reduce that nerve irritation so that your brain-body communication can be better and you can move better and function better. And now it's important to remember that, yes, you may have areas you feel and may notice, i.e. your hip, but you may have areas that you have no idea about. That's why it's so important to get tested to know what's going on the inside. And many people, once they start addressing the health of the spine and nervous system, well, they report that they function better, they're more comfortable, they're able to keep up with life that much better, and they're able to bounce back quicker. So consider the health of your spine and nervous system, as your body's master control system is your nervous system, and corrective chiropractic helps that system work better so you can heal and perform that much better and the way you want to. But consider that today. And of course, I loved having you. And if you enjoyed this, please take a moment. Make sure you subscribe and like. I'd love to be more a part of your health journey along the way and help you out. So thanks so much for tuning in. And remember, you're far stronger, more resilient, and resourceful than you may have led to believe. Bye for now.